So Africa will take a decisive step towards health sovereignty when more than 500 policymakers, regulators, scientists and industry leaders gather in Mombasa in Kenya for the 7th Scientific Conference on Medical Products Regulation. The conference will explore how harmonized regulation can boost local production, trade and Africa's response to public health emergencies. So over 90% of medicines are imported into Africa and less than 1% of vaccines are produced locally. For more on this now, we're joined by Chimwemwe Chamdimba, who is the head of the African Medicines Regulatory Harmonization, joins us now live. Thank you very much indeed, ma'am, for joining us this morning. This is quite a critical conversation for us to have. And in particular, if you look at the numbers of individuals who are gathered or will be gathering at this event, it talks to us about the importance of the discussions that will be held there, in particular, harnessing innovation and artificial intelligence in regulation. That's part of what the discussions will be about.
Yes, exactly. And thank you for having me today. As you've said, this is a very important moment for the African continent. Particularly, we saw, I think, what happened during the COVID-19 pandemic and as well as the other outbreaks that have been happening on our continent, that when it comes to responding to them effectively and having countermeasures that we need to respond to these challenges becomes an issue for the African continent. And as an African continent, we made a decision that we will take our health in our hands and we will drive towards health sovereignty. And I think this is not about the future. This is about now. So as a continent, we are gathering together with our partners, as you have said. We are pulling together regulators, researchers, policymakers, civil society, as well as academia, to dialogue to discuss and agree on the movement towards ensuring that every African has access to quality assured, safe and effective medical products that we need to respond to our challenges. And as you have said, we cannot deal with it without really looking at technology. Currently, we have to, embrace what is happening on the globally, issues around AI, issues around digitalization. We will not be able to move as a continent if we do not embrace technology. So this conference will really bring together a diverse group of individuals to discuss and agree on how the continent is going to move forward on the progress that we have already made, because this is not the beginning. We've been implementing this for quite some time as a continent. We adopted the Pharmaceutical Manufacturing Plan for Africa in 2005, and we have been driving its implementation at the African Union Development Agency through our African Medicines Regulatory Harmonization Initiative, understanding that we can't talk about innovation, we can't talk about research, we can't talk about manufacturing, and we can't talk about intra-Africa trade in medical products if we do not harmonize our regulatory systems. And we have had so much progress so far, and significant to it, I think, is what we are currently doing, transitioning from harmonizing through the regional economic communities to the establishment of the African Medicines Agency.
And I mean, anchoring Africa's regulatory future is quite important. You raise a very important part about what happened during the COVID-19 pandemic, where you have vaccines that are not manufactured on our soils. We saw the challenges that came with that. So this would be an opportune time with so many of these important stakeholders that will be gathering to find solutions, that it not just be a talk shop, but the next time, and hopefully that does not happen, the next time we're beset with a challenge such as, or health challenge such as a COVID-19, Africa will be able to stand on its feet.
Exactly. Actually, the African Union has already started making movement towards local manufacturing. I talked earlier about the Pharmaceutical Manufacturing Plan for Africa. And recently, after COVID, we saw our colleagues at the Africa CDC also driving the Partnership for African Vaccine Manufacturing, which has turned into a broader movement towards manufacturing of products in alignment with what we are doing through the PMPA, the Pharmaceutical Manufacturing Plan. But at the center of it is regulation, because we want to ensure that whatever we manufacture on the African continent is of quality. and is safe, and our populations access the products that will effectively respond to the health challenges of the continent. So what we have done so far, I think we cannot talk about this as the future. It is happening now because we can't wait. Africa is already moving into that future. I want to give some 4 good examples of what we have done as a continent
Yeah.
that shows that we are making bold movements towards really addressing this challenge on access to quality assured medical products. Through our program, the African Medicines Regulatory Harmonization Initiative, we've worked with the regional economic communities to already adopt harmonized standards, guidelines, and processes for regulating medical products. And through this, regs have been able to pull countries together to do joint assessments of products so that we bring in efficiencies into how we bring products to our population. That's the first thing that we have done. The second thing that we have done is that we know that we cannot talk about regulation, we cannot talk about local manufacturing if we don't address issues of policy and law. So we actually supported the adoption of the AU model law on medical products regulation. And with that, we have seen so many countries. Actually, currently, we have over 20 countries on the continent that have already domesticated this law, meaning that they are ready and they want to move forward together. But also recently, just about last year, we actually started a continental pilot for listing medical products. Why did we do that? We want to be able to come together as countries on the continent to evaluate applications for registration of products, to ensure that we make the African market a real single market. Because if a manufacturer on the continent has to navigate 55 requirements from 55 AU member states, it makes our market unattractive for investment. It makes our market unattractive for trade. So we are trying to address these non-tariff barriers by ensuring that we push harmonization, we list products together, and actually brought products to the market, which I think we are proud of as a continent. And lastly,
Yeah.
the bold move of establishing the African Medicines Agency.
Yeah.
It's not just an organization, it's a bold statement that Africa is not waiting. We are really moving forward and we are transitioning from what we have been driving at the African Union Development Agency on harmonizing our standards, guidelines, and regulations to ensure that we manufacture and trade our own products into reality through the African Medicines Agency. So it is an interesting time for the continent, and we are taking significant movements towards ensuring that access to quality assured products.
And part of that would, of course, be, implementing international standards and also ensuring that, there's advanced pools procurement and intra-Africa trade so that whichever a country on the continent is able to pool faster, others on the continent are also able to benefit from that. These talks are about bringing Africa together to ensure that ultimately, when it comes to regulation or harmonization, if we are to deal with another crisis, that Africa is able to put its best foot forward.
Exactly. So the thing is, you and me as citizens, when we are, taking a product that has been procured or that has been put on the table for us in Africa, manufactured in Africa, it should be at par with anybody or with any product that is produced elsewhere in the world. That is why we are adopting international standards that are at par with everyone. And as you've rightly said, when we adopt this, we want to make sure that we unlock certain things. We unlock manufacturing on the continent, and we ensure that what one country produces, because previously, before we started our African Medicines Regulatory Harmonization Initiative, if a manufacturer is to take a product from one country to the other, they will have to face different regulations, different requirements, which meant that we really were not able to respond faster to our health challenges. You saw even in COVID, for us to move products from one country to the other to respond to the challenges that we had, it was very difficult. And countries realized that no one country can do it alone. No one country can walk alone. And if we are to really address comprehensively our challenges, we need to look at the entire African population. Moreover, I think when you look at health challenges see no borders. We cannot say that today we are in South Africa and there's an outbreak in South Africa. It will not very soon go into another country, go into Botswana, go into Swaziland, go into Namibia. Our borders are open, and diseases move with the people that move with those diseases. So we need to work together as a continent, and we are doing that currently through the African Medicines Regulatory Harmonization Initiative, led by the African Union Development Agency,
Yeah.
that is now transitioning to the African Medicines Agency.
Chimwemwe Chamdimba, thank you very much indeed, the head of the African Medicines Regulatory Harmonization